Nationally, the numbers of new COVID infections is on the rise. The number of hospitalized patients in Maryland has doubled over the last 3 weeks. 3 weeks ago, we had 500 hospitalized COVID patients in Maryland. As of this past week, we were at 1,100. And we've also seen a doubling of hospitalizations across Johns Hopkins Medicine hospitals over the same time period. We've also seen cluster outbreaks with our faculty, employees, and learners. In our daily testing of Johns Hopkins Medicine faculty and employees prior to last week, the largest number of employees to test positive on any given day was 23. This week, we have peaked seeing where there are now more than 63 testing positive. Through contract tracing, our faculty and staff are being infected through community spread. To tell us what's driving this new wave and to talk about the new Omicron variant and how to keep everyone safe this holiday season, Dr. Lisa Maragakis is joining me here today. Hi, Lisa.
Hi, Kevin. Thanks for having me.
You know, I'm so glad you're here because I think everyone is wanting to understand what really is driving the increase that we're seeing in the COVID infections.
You know, Kevin, this is like a perfect storm of different things coming together. We had already seen the Delta variant of the virus sweep through and cause some breakthrough infections and rising case numbers. And then we hit the holidays. So we have recently had the Thanksgiving gatherings and holiday celebrations. And I think that fueled a surge in the Delta variant. And then just on the heels of that, we're starting to see rapidly Omicron variant appear and sweep through the population. So all of this is building at the very time that we're entering the respiratory virus season, where colder weather, drier conditions, drive people indoors and into closer proximity with each other. So it really is a perfect storm.
It is a combination of things that's occurring. So just so that people understand and talk about the differences for just a minute with us around what you see different about the Delta variant versus the Omicron variant.
Well, what we're seeing is the virus mutate and really adapt. And unfortunately, so the Delta variant had some mutations that allowed it to be more easily transmitted and to break through some of the individuals who had already had previous COVID infection or those who were vaccinated. But when we see the Omicron variant come along, there are even more mutations. And so this allows the virus to evade the immune response and cause infection in people who have had prior infections, vaccinations, and sometimes even the booster.
You know, Lisa, you and I have had conversations where we both are concerned about what we see happening in our community, but we're also concerned about what's happening in our health systems and hospitals across Maryland and across the country. Talk to us just a few minutes about, we're in a workforce shortage as many industries, but we're also seeing our own employees become infected. And talk to us just a minute about the implications of the unvaccinated versus the vaccinated in our hospitals and the potential risks of overwhelming the health systems.
It's such an important point. And my top concern right now is the healthcare system in our nation, in our communities, and keeping our capacity to provide healthcare, not only for those who are infected with COVID, but for everyone who needs any kind of healthcare. So the arrival of Omicron and the surge that we're currently seeing is really placing a burden on the healthcare facilities for the reasons that you mentioned, an influx of patients that require hospitalization and medical care, but also illness amongst our staff and our personnel. And that is causing a true crisis for healthcare capacity in our nation. And I know everyone's very, very tired of hearing the messages about precautions like masks or distancing or changing the way that we do things. But I think it's important to know that right now, we need to do that in order to preserve the healthcare capacity in our country so that we can all get the care that we need when we need it.
You know, there's a lot of talk about the vaccinated versus the unvaccinated. And in Johns Hopkins Medicine, 70% of all the admissions currently are people who are unvaccinated. And in our ICUs, over 99% of the people there are unvaccinated. But we're starting to see 30% of the people being hospitalized, people who have only had their first and second shot. They've not had their booster. So talk to us a little bit about the importance of that booster and the implications for waning immunity.
Right, so vaccination is such an important part of the toolkit that we have to protect ourselves and our families and our communities. And you're absolutely right. The unvaccinated are at the most risk and the highest risk of not only catching the virus, but also having severe consequences and severe disease and the risk of death. Most of the hospitalized patients, as you outlined, are unvaccinated, and communities where there are many unvaccinated people are particularly at risk of seeing the virus sweep through and having this healthcare capacity crisis. So we know that getting vaccinated provides a large degree of protection against hospitalization and serious consequences, including death. But now we also know that immunity wanes relatively quickly over the first 6 months after vaccination, and that's why there's such an urgent need for everyone to get a booster if it's been more than 6 months after getting either the Pfizer or Moderna vaccine, or if it's been more than 2 months after getting a Johnson & Johnson vaccine.
So in addition to getting vaccinated, you talked about masking, you talked about social distancing. What else should people be doing during the holiday season to be safe?
Well, I think I like to think of it as layer upon layer of protection. So the very first thing is make sure you're vaccinated, make sure you get your booster, and that those around you also do that. But I think that it's not a choice between being completely closed and completely open. I like to give the example of healthcare, where we come to work under the most risky conditions of taking care of patients who are known to have the virus, but we can do so safely. So think about what it is that you need to do and the ways in which you can mitigate the risk when you do that. And that is by being vaccinated, by getting your booster. Sometimes testing can add another layer of safety if you and the people with whom you will gather can get tested close to the time of the gathering. But then there are simple things like masks that really have been shown to be incredibly helpful in interrupting transmission person to person. We know that getting together and eating together is one of the highest risk activities, and that's because we of course have to take off our masks. So during the holidays, that's a challenge, but finding ways to come together, be together, and still separate or be outdoors if possible, or have more distance when you're eating and removing your mask. That's the safest condition.
So Lisa, thank you for being with us today and sharing your expertise. You know, during this holiday season, I hope that you actually find peace and joy and hope. But my biggest hope for you is that you appreciate life. And because of that, I encourage you to be vaccinated. For more information about the Omicron variant, visit hopkinsmedicine.org. And on behalf of Johns Hopkins Medicine, we wish everyone a safe, healthy holiday season.